Good morning, everyone. I'm Megan Culp, along here with Scott Michlin.
Good morning. It is Thursday, October 8th.
It is.
Week 30, you
30.
said. Wow. Well, I think we're still on week 29. I don't know why I still thought that, but we're
I
apparently
trust
we're not.
our trusty calendar source.
Yeah, but I thought it was 29 on Monday.
It's 30.
All right, we'll check on that.
Calendar source, if you're listening, can you please throw us a bone
We
right
will
now?
check. Oh, look, and you're not who you're supposed to be.
Apparently I'm Mark Decker today.
Yeah.
Oh.
Well, good luck with that. Have fun with that. Let's change that real quick.
Try a new identity this morning.
Yeah, we can do that. Sorry.
But I am actually Megan Culp, and so while you get that done, you want me to share a fun story?
Okay.
Okay. So
What you got? There you go.
as we know,
There, back. Everything's good.
folks are working from home more.
Yes.
We know that.
Not us, but others are.
Not us, but so somebody, my trusty algorithms, shot me a text this morning with a story about a guy that is rollerblading around the neighborhood. That was his secret passion, and now that more people are working from home, it's like the talk of the hood. It's this guy, and he's like middle-aged,
right?
And he's all like elbow padded and knee
Nice.
padded up, and he's bringing the rollerblading back.
Just because?
Just because it's
He's
fun.
not like delivering anything. He's just doing it.
He's just like having fun, and apparently it's been the talk of the block.
All right.
So.
Well, there you go.
Yeah.
Hashtag 2020.
Yeah, exactly.
What do you
I
want?
never assumed that
Yeah.
rollerblading would make a comeback. I remember during Hurricane Sandy,
Right.
so watching like the news at like 2 a.m, and so apparently the X Games are still happening. I just want to let everybody know that.
Okay.
Rollerblading still a sport.
There you go.
So anyway.
Interesting. Okay.
Yeah.
Well, thanks for that. Well, now that your name is correct. And
We can move on.
We can move on. Sorry about that, everybody.
Yeah,
but
geez.
today on the show, we got a great show planned for you because we are going to be talking to a parent of school-aged kids who's very concerned about schools being closed and really wants to get schools reopened and get his kids back into school. They're not doing as well as he would like them to do. I don't believe. We'll ask him with the virtual learning, and certainly there are many other parents in the same situation.
Yeah, he's
Definitely
not alone.
Understand that. And we have our doctors back on the show. Dr. Erin Philpott and Dr.
Yes.
Brad Greenberg from San Juan
Yes.
Regional Medical Center will be talking to us a little bit later on. We're going to be asking them a little bit about some of the treatments we've been hearing about in the news, of course, with President Trump and some of the other folks that have been infected. We're hearing a lot more about treatments, and so we're going to talk to them about that.
Yeah.
So
It's going to be a good show.
Coming up, yeah. So why don't we start with our guest, who is already on the phone.
Yes.
And I know is anxious to speak with us, as we are with him. Grady Williams is joining us, and like I mentioned, he is a parent of school-aged children in Farmington. Grady, good morning. Thanks for calling in.
Good morning, Scott and Megan.
Thanks for being here. And remind us how many kids you have, Grady, and what grades they are in.
Okay, I have three children, a 12-year-old in 7th grade, a 14-year-old in 9th grade, and a 16-year-old in 11th grade.
Okay. So these are all older kids, and so they are not going to be going back to school anytime soon, right? None of the information that we have heard indicates that the high schools and the junior highs are going to be opening. It's really grades like K through 5 that we're hearing about, correct?
Yes, it's K through 5, and that's the part that's very troublesome because of the mental breakdowns that we're having with our junior high and high school kids.
Right, and you are also part of a Facebook group I want to mention too, Open Our Schools NM, which has about 3,000 members, and you're one of the administrators of that group, right?
Yes, sir. I started that when we're on Facebook. I posted some of the problems that we were having, and I thought it was just our family. And then after making that post, I coached for 12 years, and one of my parents called me, and she just walked in on one of my former players that had attempted suicide. And at that point, we realized that, we got to do something about this.
Right.
Yeah, that makes sense. And so let's talk about the different dynamics going on here. When we're speaking about kids' mental health, breaking down, as you stated, which I think is apt for many kids. What do you think this is more related to? Is this related to the extra stressors of not seeing your peer group, which we know is important for every person, especially the adolescent age group? Is this about trying to keep up with self-directed learning? What's going on there?
I think it's a combination of several different factors. Because children feed off of our stress levels, which parents, they're worried about their jobs or they don't have a job, or so they feed off of that. And then on the other side is we've taken everything away from these kids. The kids that played sports or went to the park, or they played band, or they lived for choir, they rodeoed. Those things that they used to do, they can't do now. And so I think that started the process of soon as that, because I had 3 student athletes in my family, and when they first took away sports, at first it was a good thing, and we got to spend more time as a family, and it was a good thing. But over about a 3-week period, I started watching in my own family, my kids starting to lose hope, just stay in their rooms and not be the outgoing kids that they were. And then whenever school learning started, the online learning, it was a disaster at the beginning. And we tried to, if we can get to our September, our Labor Day, then we can get back in school. And that didn't happen, and then it got worse. And it's continually got worse to where you're working, till 11 o'clock at night on homework. After coming home from work, the kids have been working on homework for, 10 hours a day. We're expecting them to act like adults, and they're kids, and they just can't handle the pressure on that. They can't handle the pressure of sitting at a desk watching that while everything else is going on around them in their house. The dogs are barking, there's a TV. Parents are working, so there's nobody watching what's going on, and they get sidetracked so easy. That's caused a huge problem. But then the failures, we work on homework all day long, and the kids are still failing. And failing every so often is a good thing because it makes you work harder, it pushes you harder. But when you're consistently failing day in and day out, it leads to hopelessness. I mean, depression, and as we've seen, attempted suicides and suicides. We've had 4 suicides in junior high to high school kids in the San Juan County area, and by parents that didn't want to have their story out in the open. But 7 different parents have contacted me that their children have attempted suicides due to all just constantly failing every day. It's a recipe for disaster.
Sure, yeah, and 7, of course, is an astronomical number by far. Absolutely. And so when we're talking about ways that parents are brainstorming, coping while we are stuck at home, have you guys come up with any way to maybe establish like learning pods on your own, safely, of course, and maybe a large space apart? Or have you guys been coming up with any sort of problem solving, outside of the advocacy that you're doing, which I think is also important? But what about other ideas and how to help these kiddos and these families cope?
Yes, we've actually had several parents and teachers establish, pod groups, willing to help and tutor, and some other, just activities, letting the kids be social and be around each other. And a lot of that goes on in our group. And, just trying to get the kids some sense of normal, because it's everything that was not normal, has been taken away. So it's given a little bit of relief. And the kids that have been doing it, in some of these pod groups, study groups, it's made a world of difference. In 2-3 days, you can see an entire change in a child. It's insane, and that's a big problem. Talking with counselors across the entire state, because we got stuff going in Hobbs, Farmington, Roswell, that have gotten groups going, but talking with counselors across the state, 14 to 17-year-olds are, 14 to 17-year-olds are the most vulnerable during this social distancing, and they're out of the 12 that I've talked to, estimated 80% of the teens are experiencing mental health issues.
Certainly. Well, and we certainly understand that. And I know, Mr. Williams, with your situation and other families, there are some parents who may be listening this morning that are saying, but my kids are doing fine with the virtual learning. And while they miss their friends and miss their sports and miss all those things, they seem to be doing okay. And so obviously you understand that there's different responses to what's going on. Not everyone's in the same situation, right?
Oh, I definitely understand that, and I mean, it's exciting to see the kids that are actually doing good, and for some kids that is, and they're excelling. That's awesome. That's great to hear. Not everybody is, and you're never going to have everybody all in agreement on one thing, and so I mean, we fully support the parents and the kids that are doing that are doing great. Good job, keep going. But for the ones that aren't, we got to figure out a different solution to the problem.
Sure, of course. And let's talk about openings here because, as you've mentioned, there's been sort of a lot of seemingly false hope, and, we hear from the state that this is just their way of adapting. But for folks in the community that don't have kids in school that are watching this, witnessing these problems, what is the update that you've received as far as when the older kids maybe can go back to school? Is there like a projected date or any talk about that?
So I've been on the I'm just a normal dad, and so I've gotten thrown into the wolves, and I mean I spend a lot of hours talking to people in Santa Fe, and the best I've heard from is possibly January for the older kids, and that's just very troublesome to me because how many more kids are we going to lose before then? It's as the executive director of New Mexico AA, the
New Mexico Activities Association.
Yes.
Yeah.
She said 70% of student athletes have 1F, and statistically, student athletes average a little bit better grades. So we have an estimated 340,000 kids in school. That is, I wrote the number down. Where did I put it? 240,000 kids that are failing. So whatever we're doing as a state is just not acceptable. If 240 kids are failing, how are we helping their mental state, or how are we setting them up for the future?
Sure. No, that makes a lot of sense. And I do want to ask you, too, a little bit about, as these folks in Santa Fe try to work on a plan to get these older kids back into school, certainly they want to do it safely. Certainly we still have a pandemic. We don't want to see any kids get sick, right, or hospitalized. And so it's kind of a juggling act, isn't it, to try to figure this out of how to do this to help the children, help the students, keep the teachers safe, the students safe, and make this all work.
Yes, and with that, I have a close personal friend that stopped by the house 3 nights ago. He's a mid-school teacher in Chandler, Arizona. They do year-round school, so they started, I believe it was July 14th, and they open schools fully. They've been in school, 3 months now.
Right.
And they wear their masks into the school, down the hallways. If they can social distance in the classrooms, be further than 6 feet apart, they don't have to wear their masks. And they've had 0 outbreaks. So, so it makes you wonder. I have a niece that's 45 miles away, and she's going to school in Denver, and she is a very high risk person, and she's been in school for a month and a half, 2 months, and doing great. They're not having problems. So I think there's ways that we can get the kids back into school and get them back to learning and feeling like they're actually accomplishing something.
Certainly.
Because right now they just feel like they're thrown into a virtual world where none of the stuff makes sense. And I mean, I give the teachers credit, because we've had teachers call us at 10 o'clock at night to help with homework, which is amazing, and I really appreciate those teachers.
Sure. Well, it's a good point that you make, that other states are somehow making this work and having some plans, and I know our folks in Santa Fe, I think, are trying to work towards that too. But I get it, that the time is ticking, and we need some answers sooner than later, for sure. With your situation, Mr. Williams, I mean, even if they came back and said, we could send your kids back 2 days a week rather than 5 days a week, would that be better than nothing, or what are you hoping for?
I mean, ultimately, I hope for us to open up, which is not it's just not realistic with what's going, with what we got going on so far. But 2 days a week, for kids to be able to raise their hand and I don't understand, instead of having to send an email and then come back. I mean, that's just raise your hand, okay, and then the teacher sees the problem, and then, she or he can, address the problem and help a whole class at once, instead of one child at a time through an email. And I mean, it would take so much work out of off of the teachers, and a load off their shoulders, and the kids themselves.
Well, Mr. Williams, we appreciate your time this morning and talking to us a little bit about your frustrations. We can hear it in your voice, and I certainly sympathize with you and your family. And thank you for letting us a little bit of insight into what you and your kids are going through. And again, the group on Facebook, if folks do want to reach out and connect, is Open Our Schools NM. But I imagine in all the things we don't like about Facebook, getting folks together to talk about these important issues is one of Facebook's good things. So thanks for calling in this morning.
Thank you guys for your time.
All right. Thank you very much. We appreciate it. That's Grady Williams. He's a parent of several school-age children here in Farmington, talking to us this morning on KSJE. I don't know the answer. I don't have an answer.
None of us really have the answer.
Yeah.
So as the science is rolling out, and as we watch other states and their handling of this, and I know New York City was, obviously they bore the brunt of it really early on before it spread more across the country. And actually the breadbasket area of the nation is being hit hardest right now. For a while, places like Montana and Wisconsin and those places were, as they refer to the breadbasket area,
right,
I guess, had been doing really well. And Wisconsin in particular is a super hot spot, and they have a lot of prominent universities that have opened there. And so, New York City's having to scale back, I think, as well. They've had some new surges, and so they're trying to figure it out. This is definitely a in and out type of game here, and that, as we heard Dr. Boswell mention last week, or Monday, that the indefinite...
Seems like last week. See how you can get confused? See?
Last week,
you.
Monday, whatever.
It's still week 30.
That the indefinite nature of this is really difficult.
Right.
So.
And that's got to be it. And I get that. And for the kids as well. I mean, they as we had a comment on Facebook, they need to socialize. I get that completely. But you got to do it safely, obviously.
It's tough.
If you're going to do it.
It's very tough.
Yep. And I'm not a parent, so full disclosure, but my heart goes out to these parents who are trying to deal with going to work, coming home, as Grady Williams said, helping with homework till 10 o'clock at night or so. Mm-hmm. I mean, they are being asked to do a lot, and the teachers are too. So I get it. But we appreciate his comments and his insights for sure. So again, thank him for calling in this morning. The other things we wanted to talk a little bit about, even though this is a COVID show, we want to talk about flu shots. because that's important.
Super important.
Tis
Important every year.
tis the
and
season.
Definitely important this year.
Right, and so again, we remind folks that there is some drive-through flu shot clinics scheduled in town over the next several weeks here at San Juan College next Wednesday. Will be happening. One happened yesterday, Wednesday the 14th, and then the other following Wednesday the 21st. Here at San Juan College in front of the Henderson Fine Arts Center, 9:30 a.m. to 12:30 p.m. This is I believe it's a free event with insurance, $20 without insurance is what it says on our poster. So
Yes.
there you go. And this is from AFC Urgent Care and Walgreens. And then San Juan Regional has announced their plans for their flu vaccination clinics that are coming up here in the county. The San Juan Regional Medical Center drive-through clinic on Saturday, October 24th from 9 a.m. to noon at the North Visitor parking lot at the corner of Maple and Schwartz. And again, at October 31st, Halloween. Get a flu shot for Halloween. There you go, 9 a.m. to noon. Again, corner of Maple and Schwartz. That's right over by the main hospital, and they will get you a flu shot.
Yeah, we already got ours.
We did get ours. Yeah,
Yeah,
no muss, no fuss.
that's right.
Right? It's pretty easy. So that was a good thing. But we encourage folks. All the doctors are, I think, encouraging. Well, all of them are encouraging everyone to get their flu shot this year more than ever because of just the potential complications from. And you told me, can you imagine getting the flu and COVID?
Yeah, you don't want the
No,
double
thank
trouble.
you. No,
yeah.
I don't. I really don't. Speaking of which, COVID testing continues tomorrow here at San Juan College on the 9th, October 9th, from 7:30 a.m. to 9 a.m. Here, again, it's in front of the Henderson Fine Arts Center. You can't miss it. It's a gigantic white tent, and they just drive you through, and they ask you, of course, to register before you come for COVID testing. And you can call, of course, the number 327-4461. 505-327-4461 for the coronavirus testing here at San Juan College. So we only have 3 days this week of testing.
Yeah.
But that's okay. The numbers?
Numbers.
Shall we talk about numbers?
Let's do it.
All right. Johns Hopkins is tracking the numbers, of course, worldwide. And we have them on the screen right now. Megan?
We have 7,554,434 cases confirmed in the United States alone, which is an increase of 50,341 cases just in a day. Significant.
That seems high.
And U.S. total confirmed deaths are at 211,905.
Okay.
Also high.
Very
obviously.
high. Yes. So there you go. That is the Johns Hopkins numbers, and I'm just getting something ready for the next segment here. And now it's ready, so I can move on to the graphs from San Juan County showing the numbers. This is, of course, the averages, 7-day averages across our state. And so, again, for our viewers, the top number is New Mexico. The bottom number in green is Navajo Nation numbers. The bottom number in blue is San Juan County numbers. So as we can see, our state is not doing very well. The line is continuing to go up. The curve is going up. However, in San Juan County and the Navajo Nation, the line is going back down after a little bit of a blip up a week or so ago. And so we're encouraged by that in our region, but our state is certainly not doing well. And the other numbers will kind of bear that out here in just a second.
Yes.
So that's what things are looking like there. Again, San Juan County, we looked, I think last week we saw that yellow line going up, and we were concerned about that. The averages of cases here in the county, they have flattened out. They're still higher, but they're flattened, and so that's encouraging that they're not continuing to increase. And then the number of deaths are still lower, and so that's encouraging as well. Our COVID-19 deaths in the county are fairly low, and we're grateful for that. So that's important as well. As we take a look at the numbers, this is the concerning one from New Mexico yesterday, an additional 426 cases across our state yesterday.
That's a higher number.
Yeah.
Yeah.
Yeah, and they've been high this week. I think one other day it was like 300 cases as well. Now, in San Juan County, again, take a look, only 10 new cases, still significant, but not as high as we've seen, and certainly not as high as in other regions of the state, so we're grateful for that. 2 additional deaths in New Mexico, and one of those was here in San Juan County. We've now lost 201 folks to coronavirus here in the county, and there were an additional 277 recoveries in our state for a total now of 17,766. So that's encouraging as well. The other stories that we wanted to pass along to you, again, this is from KSJE.com, our COVID-19 news page. The Farmington schools released a statement yesterday that one of their students had tested positive for COVID-19. The student was attending a NMAA and district-sponsored event, and so they were in contact with other folks on school property, and so we felt that was important to share it with the community. They have done all the contact tracing and everything else who may have been in contact with that student, and so those procedures have been followed, but that is what has happened and been reported by Farmington schools. Again, those are the daily New Mexico numbers, and the Navajo Nation numbers are about a day late. They're still from Tuesday, but they were still fairly where they've been, about 17 new cases, 1 additional death across the Navajo Nation. They have 10,501 cases, 560 deaths across the Navajo Nation as of Tuesday. So that's where we are with that. So there's that.
Yeah, tough stuff.
Right. And we got confirmation that this is week 30. So
See?
Our calendar people are keeping
I've been
us
paying attention.
right. They're keeping us on track.
Yes.
Which I appreciate.
Me too.
So, time to go to our next guest?
Yes, let's do it.
All right, here we go.
Pre-record with the docs.
Here we go. Joining us this morning to talk a little bit about conditions here at San Juan Regional Medical Center is Dr. Erin Philpott and Dr. Brad Greenberg from the hospital. Good morning, doctors. Good to have you here.
Good morning.
Good morning.
There they are. Thank you for joining us. And again, I know Megan and I both have a lot of questions for you, and so we'll get right to it.
Yeah, so recently, as recent as October 5th, actually, the CDC put out some revised guidelines on the aerosol question. We know there's droplets, and we know that there's a question about aerosols, and especially as we move into colder months and we start gathering inside enclosed spaces. Can you speak more about that?
Yeah, sure. This has been something that has continuously come up with COVID since the beginning of the pandemic, and sort of the implications of these two different modes of transmission for us in the hospital, but as well for the general public, and what exactly they mean. And I think we have seen cases really across the world that demonstrate there was probably an airborne transmission component or aerosol transmission in the choir in Washington, and then I think there was like a gym in, I believe it was South Korea. There was a restaurant in China. So a number of different cases that really were quite compelling for probable airborne transmission. I think it gets a little bit complicated. People like to really call it black and white. You know, does this need an N95 or a surgical mask is the big question in healthcare, of course, and then go from there. But the idea here is it's really a continuum, and you know, some define aerosols technically as less than 5 microns, and others define as droplets as greater than 5 microns. But the idea, the most important pieces to it are that the droplets fall out of the air with the viral particle in it within 6 feet. So, and that's where kind of that 6-foot distance rule comes from. Or maintaining that social distance. Whereas aerosols, they can, they basically leave a little bit of the virus hanging in the air for a period of time. And scientists have been able to pull it out of the air. And then the question becomes then at that point, yes, it's airborne. Probably a lot of respiratory viruses are. But then how contagious? Is there enough virus in the air to actually get it? And that's where it gets a little complex. So the CDC releases this update to their transmission, information surrounding transmission of SARS-CoV-2 just on the 5th, as you said. And it's not really new to us, but it's just more formally described by the CDC as they've integrated all these different cases and the data behind it. So still, surgical masks, everyone masking will significantly reduce that projection of virus into the air. And those social distancing measures are still very important. And droplet transmission is thought to still be the primary mode of transmission. And it may be that some people, these super spreaders that we've talked about before, are the ones that are, for whatever reason, have the propensity to aerosolize, whether it's the virus in their body or how they talk or how they sing. But certainly that risk increases inside poorly ventilated spaces and in close contact with individuals who have COVID-19. Do you have anything to add, Dr. Greenberg?
I just think that it's important to emphasize here that really the mode of transmission is thought to be by far predominantly associated with large droplets. And so that's the first thing. The second thing is that if we look at the recommendations of the state of New Mexico and what our organization does as far as universal masking, wearing a mask all the time, regardless of distance, and trying to engage in social distancing practices, both of those things will significantly reduce risk of transmission by either form, by either droplets or by aerosols. And so I think I think it's important to acknowledge that in some of these cases, like Dr. Philpott mentioned, it's hard to explain away transmission that must have occurred by aerosolized particles. But I also think that the research is ongoing, and we at San Juan Regional Medical Center just considered this very topic as far as whether or not we needed to modify some of our processes. But after a thorough review, we're going to stick with our processes, universal masking, universal eye protection in clinical areas, and select deployment of other kinds of respiratory protection in areas that are higher risk. So I think that it's very important for us to stay on top of changes in the science, and we will continue to adapt to meet the needs of all the folks in the Four Corners.
Great. And so this is a real pertinent question for Scott and I. Does this mean we get a free pass on gym guilt this year?
Gym guilt.
Gym guilt. You don't have gym guilt every year?
I
No?
think
You've met me.
you definitely do.
All right. Okay. Great. Thanks, guys. And let's switch gears to treatment questions. Obviously, we've had big news recently, and remdesivir has come back up into the news. So what is the status on different treatments that are being used?
Yeah, so, not a lot has changed on the treatment front, unfortunately. We don't have any great novel therapy that has shown very promising benefits. I think, of course, remdesivir has come up because of President Trump, but, we've been using that now for several months. The data behind that, the, high-quality study of the randomized control trial demonstrated that you have a decrease in duration of illness, a slight decrease, but otherwise didn't really demonstrate a really strong mortality benefit, though did show a trend towards mortality benefit, meaning it may save some lives. So we've been using that pretty consistently throughout. That still, does not have formal FDA approval. It's under the emergency use authorization. We've really I have not personally seen many side effects, certainly no serious side effects. I think we've had to stop it 2 or 3 times in patients in our hospital, and we've given many, many doses. So I think overall, as demonstrated in the studies, it's pretty safe and well tolerated by people. Convalescent plasma, it too received emergency use authorization based on fairly limited data. So we have not been currently using that in our hospital just due to the lack of data to suggest that it is high yield, and our COVID cases have gone down, though they're going back up again. And then I think the interesting thing that has come up with Trump is the use of steroids. And that is probably the single most effective treatment in patients who are hospitalized requiring oxygen, meaning a very large randomized controlled trial out of the UK with several thousand participants demonstrate significant mortality benefit. So it literally saved lives when given. But the interesting thing is there was a negative signal, meaning that it might actually do harm among people who are not in the hospital or not requiring oxygen. So I think that's just a little bit interesting that Trump did receive it. So he likely was ill enough that his doctors thought he probably would benefit from it. And then there's some other treatments still in the pipeline, a number of studies going on, but nothing new and wonderful yet.
Got it. Thank you very much. Interesting. And so these treatments, I guess, they're not necessarily cures, but they are treatments. And so they are just these steroids and the other drugs that we're talking about. They just kind of help the body then to try to recover from this infection. Is that the best way to describe it?
Yeah, that's exactly right, Scott. It's much like flu. You know, like strep throat, you get penicillin and you feel better after 24, 48 hours. It was a magnificent discovery for us, but we don't have any magic bullet for viruses. You know, they're difficult to treat. You know, flu, we give Tamiflu, and that, again, helps shorten the duration of illness, similar to remdesivir, but doesn't significantly change the course or the outcomes. So it's really what we call supportive care. And we, as physicians and the scientists, are still trying to figure out the most optimal timing for each of these medications, whether people are in this viral replication phase, so earlier in the course of the illness, where they might benefit from remdesivir and convalescent plasma and other medications that might decrease the viral load and prevent the damage incurred by the virus, or the steroids that are given later in the course of illness when people are in that inflammatory phase. So it's a complicated situation with coronavirus and figuring out how to best support people through it.
Sounds like it for sure. I'm sorry, Dr. Greenberg. Go ahead.
I was just going to say that this isn't a novel kind of challenge. Like within medicine, the use of steroids and kind of modifying inflammatory cascades is definitely apparent in a number of other things. And controversies with this particular kind of intervention, this particular kind of glucocorticoid or steroid interventions has existed for a long time about a whole range of different problems. Some of them inflammatory and infectious, like sepsis. Some of them injury-related, like spinal cord injuries and whatnot. So this is science at work, and you know I think it's important that we approach these things in a manner that opens up certain therapies for compassionate use, which is the term before you get to EUAs, if you have a promising therapy. But at the same time, we need to make sure that all these things remain under a intense scrutiny to make sure that the science bears out the fact that they're effective, and also it supports their use despite any other apparent risks. So I know everyone wants a magic bullet, everyone wants this to end, but this is how it's done. It's a slower process. We'll try to find the right constellation of therapies that are meaningful and that don't cause harm. So the one therapy that I did want to mention, which has been in the news recently that we didn't touch on, was this so-called antibody cocktail. It's two different monoclonal antibodies. So basically antibodies that are made in a laboratory that are basically built to combat COVID-19. I believe there's two strains within the Regeneron product, and that is currently under compassionate use. So I'm not aware of a specific EUA for it, but I think that the president did receive that particular therapy, and it's still under study, and especially under study as a potential therapy early in the course of the illness that may help with sort of combating the COVID virus after it's detectable, but really before there's a significant immune response mounted by the patient or the host.
Very good. And we did want to ask about cases. So we've noticed there's a decline in cases in this area, but there's some surging in other parts of the state. Is San Juan Regional at a state where there's enough sort of openings to receive patients if needed from Albuquerque and places like that?
So we are actually in we're poised to be able to adapt. Because we've actually seen, we had a really big surge of cases in April and May. We had another smaller bump in July, and then it's essentially been declining since then. But we've actually, over the last, say, 7 to 10 days or so, noticed an increase in the number of cases and increases in the number, in our percent positivity for the tests that we're performing. And so we still have plenty of capacity to care for those. And the state of New Mexico, especially in the spring, did a fantastic job of really working collaboratively amongst a whole range of different hospitals and healthcare systems to move patients to areas where there were resources to make sure that we didn't have the excess mortality or people die when there are resources elsewhere in the state. So we remain engaged in the statewide effort, and if we need to receive patients from hospitals that usually refer to us as a hub, we are ready to do so. And if we need to look at unconventional transport patterns to make sure that we can always match up the patients with the needed services, we'll be there to help too.
Good to know. And I think you're right that that process, that system that was in place here from the spring seems to have worked out pretty well for our state, which we're all very grateful for. Just maybe one final question, doctors, we wanted to ask about these cases that you are seeing. We've heard that maybe the cases that are being presented at hospitals around the state and around the country are maybe less severe than maybe they were earlier on, say in the spring or so. Is that something that you can confirm here locally or not so much?
Yeah, that's a great question, and I think this is really, we don't have any solid data on this or have looked specifically at, how much oxygen are people needing when they initially present, et cetera, or kind of formally comparing. But I do think, my feeling is that we are seeing a slow rising tide, very similar to what we saw in April at the start of our big surge. And we're seeing people with more mild illness. I think some things that could be driving that perception that people are presenting with more mild illness, or people are coming in earlier. They're more aware of the ramifications or sort of how the virus can present and progress so rapidly. I think people are less fearful of being out and going to the hospital in general, so they're not waiting till they're extremely ill before coming in. So people may be presenting just a little bit earlier, which is sort of casting that perception of maybe they're less ill. But from my personal experience working over the last couple of weeks, I'm certainly starting to see admitting those patients who are on high flow again, which is the need for a large amount of oxygen. So I think the cases are probably just as severe as they have been. And I think we're also getting more accustomed to it too. Any thoughts on that, Dr. Greenberg, what you've observed?
What I've seen is people are, I'm working in the emergency department and whatnot. I think that people have become more comfortable coming to the emergency department for these complaints. We're starting to see a couple people actually even come through the outdoor area just to get a test. And so I think that the folks I think symptoms are coming back. But I do think that this isn't all folks that are just going in the outpatient setting. Our ICU remains intermittently busy on where we're taking care of COVID patients. And so I think that the important message is that despite what you may hear in the media, or in a lot of different news sources here, the virus itself has not changed. And what we can control is our behavior and the likelihood that we would have to actually get the illness. So we all hope that this is going to wind down and that we could get back to some semblance of normal. But I think right now it's very important for everyone not to let their guard down and to try to be disciplined about just normal COVID-safe practices that we've tried to adopt over the last 6-7 months, and to stick with those, especially as we get to colder months where we're likely to be closer together. And I really hope people can think about these kinds of principles when they're starting to make their holiday plans, because I think it's really important to think about making the right choices, how to engage with friends and family, how to make sure that you're staying safe, and how to make sure that everyone is aware of and trying to keep their friends and family safe and healthy as well.
Great advisement. And so one final question, speaking of advisement, generally flu shots, I know it's highly advised that we all get them for every other flu season. Is that still the case for this one? And are there demographics that benefit especially from the flu shot?
Yes, more important than ever to get your flu shot this year for so many reasons, for your own health and reduction in severity of flu if you get it, or prevention of flu, potentially if it's a great match, but also to help us and help everyone around you and us in mitigating or reducing those flu-related hospitalizations, which the flu shot is very effective at doing, in order to, make space and have plenty of room for not preventable illnesses like coronavirus or heart attacks or strokes and everything else. So more important than ever to get the flu shot this year.
Very good. Well, doctors, we again thank you so much, both of you, for calling in to talk to us and our audiences about the work that you are doing. Again, we thank you. You both are on the front lines there, so thank you very much.
Thank you, Scott, Megan. We really appreciate it.
Thank you.
Thank you both.
Thank you, Dr. Philpott, Dr. Greenberg from San Juan Regional Medical Center. We appreciate both of you, and thanks for calling in this morning. And we're back here in the studio. Scott Michlin along with Megan Cullop on our COVID-19 program. And again, lots of good information from our doctors.
Lots of good information.
Friends of the show.
They are the friends of the show.
Right.
We got to get them T-shirts. It's time.
You think they'd wear them?
I don't know.
Maybe a mask. I think I'm a friends of the show, N95.
That's a good idea.
Yeah.
Well, I don't know if we can get our hands on an
I don't know
N95,
if we
but
can.
we can print cloth ones.
We'll see what we can do about
All right.
that. But yeah, that'd be great.
We'll look in for you.
Because they're great. They're very generous with their time.
They're so generous, especially after,
And they
mostly
tolerate
for
us.
us. Yeah, exactly.
And they tolerate us.
Exactly.
So we appreciate that. But anyway,
Exactly.
it's been a great show. Lots of good information. We appreciate everybody joining us today, all of our guests. Again, we certainly couldn't do it without them and our audience. We appreciate that. Folks, if you found this show to be informative, we invite you to share it with your networks. Again, this is local information from the community, for the community, so we appreciate everyone's involvement. So thank you.
Till next time.
We'll see you
We'll
on
see you
Monday.
then.
All right, everybody. Have a great weekend. Stay safe. Bye-bye.